African American woman and depression. That will be my topic for today. So what is depression? Depression can be a group of the following symptoms: loss of interest in something that you once found interesting, excessive sleepiness, weight gain or weight loss in a short span of time. There are many forms of depression. Seasonal depression that happens with the change in weather or temperature. There's chronic depression, bipolar depression. There's also postpartum depression that happens once a woman gives birth to a baby and she has moments of sadness, sometimes psychotic thoughts as well. African American women have many barriers to the treatment of depression. There's a lot of shame and embarrassment that goes along with this disease. Patients may want to deal with depression at home or within themselves, and the problem just gets worse and very hard to treat, and it can sometimes turn to suicide. Last year, a very well-known motivational speaker and woman by the name of Karen Washington, who started a campaign named For Brown Girls, committed suicide because she wasn't dealing with the loss of her mother well, and she had some issues within her life at that time. I'm going to play a clip. In this clip, her friend talks about how she came to her and they tried to deal with it, but if her friend or herself just knew to go get professional help, maybe medications, maybe therapy might have worked, a life would have been saved. And her brand that she built For Brown Girls would have grown and probably motivated thousands more of African American girls to be comfortable within their skin.
So I just want people to know that Karen loved herself. And I know some people think that's hard to understand. They're saying, well, if she loved herself, why did she do this, And to tell a short story, when I first found out about Karen's passing, I was devastated. And I'm still in a state of really just trying to understand it. And, knowing that she was going through so much the last couple months of her life with her mother passing, I knew that she was in a very bad place. She reached out to me and we really were very close, and she expressed a lot of her pain after losing her mother with me, and I tried to assist her in really just getting to a better environment and really trying to, get back to a good place, because she was really in a place of missing her mother.
Another barrier to the treatment of depression is the superwoman syndrome that exists within the African American community. This belief that the African American woman has to pick up the deficit in her family, has to suffer in silence. This syndrome is thought to be the reason why the African American community has survived so long, but what the population does not realize is that it is more paralyzing than anything. Women have this increased stress that makes them more susceptible to depression. There is also the notion that keeping in the struggle makes you stronger, but the burden may be in fact killing this population. Everyone around them is affected. The children, the husband, the co-workers. African American women have to understand that this depression is a disease that is not only their own, but involves the whole family and anyone they come in contact with. Another barrier to the treatment of depression is lack of health care. As you see in this graph, African Americans are at highest risk for poverty, and if you look at it closely, you see that African American women have the highest percentage of poverty. Going to a specialist is not something that they can do, especially when they don't have any money to do so. They also have to trust their healthcare provider. Sometimes trust is not built because healthcare providers don't spend enough time, and when they go into the office, they have to wait so long, and it doesn't leave time for building trust so that they can talk to their healthcare provider about the issues that they are having. Cultural barriers. African American women have a strong sense of God, church, or spirituality that is just embedded in them, and it somehow has to be connected to the treatment of depression. And healthcare providers have to understand that sometimes science is not the only way to get through to African American women. They have to use their sense of spirituality, a connection with God, to get through it. Treatments. Psychotherapy plays a big part in treatment. Some of the different types of psychotherapy are interpersonal therapy, which focuses on communication with the family or with some friends. Cognitive behavioral therapy is another type of psychotherapy that focuses on action-oriented solutions. Sometimes this is not so helpful, so they turn to group therapy, which is actually very helpful for African American women because they depend on each other for problems, help. So this group therapy may help. Also, another treatment is drug treatment, and African American women really have a hard time with this because they feel that they shouldn't have to take drugs for depression, but there are some proven drugs like Cymbalta that help with the symptoms of depression. The medications that are used to treat depression include antidepressants. These medications increase neurotransmitters in the brain that help the brain function that affects emotion. There are different types of antidepressants. They are classified by the effects that they have on hormones or chemicals on the brain. African American women use drugs as a last resort. This is why they're more prone to chronic depression, because a lot of the time wait a last minute to get treatment for depression because they think that they might not have depression and they don't want that stigma attached to them. Some of the future direction of dealing with depression in African American women: giving support in the church, some teachings in the church about depression and the stigma that comes with it, as well as different types of treatment and where they can get treatment, and reminding people that depression is in fact a disease. There are different groups such as the Black Mind, which attempts to break down what depression really is and the support that Black people have with it, and how we can try to avoid getting depression, and if we do get depression, what kind of help we should get, or how we should talk to our friends and family about what we're feeling, and signs to recognize when a family member may be going through it. So ways to help African American women have a lower risk of getting depression is by teaching them how to move. When you exercise, most times you feel better about yourself, and we want African American women to feel good about themselves. Exercise is very important in the community because obesity is also something that African American women are at high risk for. Very important that we keep this talk going because there's not much research on depression in African American women, because women don't want to come forward and say that they have depression, and they don't want to participate in studies because they just want the problem to go away. So I think the biggest treatment of African Americans with depression is teaching within our churches, within our community centers, teaching amongst each other.